I'm Greg Wheatley, and my guest today on Inside Wheaton is Dr. Sandra Yu Rueger. Sandy is Assistant Professor of Psychology here at Wheaton College, and actually did one of her degrees, her master's degree, here as well. So, Sandy, it's great to welcome you to Inside Wheaton.
Thank you. It's great to be here.
Let me ask you, first of all, about your experience here at Wheaton. You did an undergrad somewhere else, and then your master's here, and then on to another place for a doctorate.
That's right.
Sandwiched in the middle there was good old Wheaton College Graduate School.
That's right.
Tell me about that.
Those were formative, important years for me spiritually. So I came from a secular university, wonderful place where I learned and grew in so many ways, majored in psychology, and just loved it. And when I thought about going to grad school, I thought about a lot of different options, but in the end decided on Wheaton because I just wanted to carve out time and space to work with faculty who were Christians and to really think about how my faith integrates with what I had learned about psychology. And so those 2 years in the master's program were just a time of tremendous intellectual growth as well as personal spiritual growth as I really tried to put pieces together.
It's interesting, as I talk to others of your colleagues who are psychologists and counselors here on faculty, all of the disciplines can be talked about in terms of integrating with our Christian faith. But I think one of the trickiest may be this discipline of psychology because so much, we've come through a period, I think, 20, 25 years ago where people were really skeptical about the integration, weren't they? Some Christians had a huge issue with that.
That's right.
Tell me about that and how you feel things are these days in that area.
I think you can get conflicts or just cautious attitudes on either side. So some Christians might think that really the Bible has all of the answers and we don't need anything more, that God gives us guidance for living and we don't need secular science to guide that process. And then you have the science of psychology saying, no room for God, right? Yeah, there's no room for God. Yeah. And I just think that, psychology is a study of human beings, and God helps us to understand and gain knowledge in so many ways. And so I just respect science and the scientific process and what we gain. But I also foundational is my belief in God and the truth that He offers us in Scripture. Yeah. So really working to integrate the two, what we know about ourselves and family and how He made us from Scripture and what we're learning from science every day.
Tell me about the various places. I noticed that you've worked in a number of settings, church-based settings, secular, for want of a better word, settings. Tell me about the variety of places you've found to work.
Sure. So when I graduated from Wheaton with a master's degree, I went into clinical work in various agencies. I worked at Community Mental Health Center and then a family service agency and worked with families and youth and just a variety of life struggles. And it was just a time for me to learn and grow about psychology and working with a diverse population. And then eventually I was invited to work on staff at a church counseling center as well. So I kind of juggled a little bit of both. And so in that setting, I worked more explicitly with Christians and families who are Christians who wanted to have their faith to be an active part of the therapy process. Actually, not always, but often. And then eventually I went into private practice. When my firstborn was 1 year old, decided to take the plunge. That allowed me to juggle family life and my work a little bit easier. A
lot of your work, Sandy, is with adolescents, right? I mean, isn't that a big part of your focus?
Well, actually, adolescence is a big part of my research focus. As a clinician, I would say I worked as much with adults as I did with children and adolescents. When I worked with children and adolescents, I often worked with families and quite a bit with their parents. So I think as I started to think about where I wanted to research in the last 10 years, that's when I really narrowly focused on adolescence.
And I want to talk in a minute about this AMOS
Oh, yeah.
Which sounds really interesting. I want to come back to that in a second.
Okay.
But when we talk about adolescence, the things I'm hearing these days, and I think people who have 18, 19, 20-year-olds are experiencing this firsthand, this whole adolescent period is sort of shifting, isn't it? I mean, kids are staying home longer sometimes.
Yes.
And I'm the term is escaping me. There's a term for that segment of people.
Emerging adulthood.
Yes, emerging adults.
Yeah.
Talk about what we're seeing in that.
Yeah. Well, I will say adolescence starts earlier as well.
Yes,
when
that's
my
true.
children were 8 and 9, and I thought, man, I've got that adolescent attitude. No, I think that in the young adult years, I think a part of it might be that it is more and more difficult for adolescents as they grow into young adulthood to just live independently.
Take the plunge and get out there.
Yeah. And so even after college, young adults are moving back home, and I think families are really wanting to be supportive of that process. And with the job market, and sometimes it can be really challenging.
Yeah, wanting to be supportive, and yet, if we're honest, sometimes, it's time parents want the freedom that comes on the other end of that child rearing as well, don't they?
That's right.
So there's this interesting dynamic.
That's right. And I think sometimes maybe parents can encourage that independence, maybe.
What do you think, is there a fear factor in terms of those 20, 21, 22-year-olds? Is it because there are so many choices, or what do you think is driving that?
Boy, that's a good question. I think, there are generational differences, aren't there? Yeah. And I think even now there are some young adults who really do want to be out there, and they make it work. And it oftentimes life can be more economically comfortable at home. So a lot of times young adults choose to stay at home to save money. Right. And
we're not in the best of economic times. So
that's right.
That also probably drives that a little bit. Tell me about the AMOS project. It's an acronym, right?
Yes.
It stands for, let me see if I have it right here, Adolescents Moving On.
That's right.
Speaking of which.
Yeah.
What's the project, and did it start here at Wheaton? Is this
Well, it did start at Wheaton, but it's a follow-up of a sample of students. I went into a middle school several years ago and gave surveys to about 500, 600 7th and 8th graders. And we asked them lots of questions about how they think about life, how they feel, the support they feel from parents, the negative and positive things that have occurred to them, that have happened in their lives. And in that original study, I looked at something called attributional style, which is a thinking habit. When bad things happen, we typically take little mental shortcuts, and we think about, why did these bad things happen? And so if you have a tendency to think about the reasons for these bad things being something about yourself, or something stable, or something that can impact lots of different things, then that's considered being having a pessimistic attributional style. And then the opposite, if you think bad things happen because of something outside of yourself, something that's not stable and something that's very specific to that situation, then that's considered having a more positive or optimistic attributional style. So a pessimistic attributional style is considered a risk factor for depression when bad things happen.
I see.
So I was interested in that and looked at parental support as a protective factor. And I found that parents continue to be important in adolescence. I think that's a message parents need to hear.
Though it doesn't feel like it.
It doesn't feel like it.
Right.
It feels like the teenagers want nothing to do with them. Right. But for both boys and girls, parents and support from parents continue to be protective for these young teens over a 4-month time frame. I collected data at 2 time points. But there were gender differences. So for girls, whether they were under stress or not, parents made a difference. For boys, it was especially when they were under stress that parental support made a difference. So I was interested in these 7th and 8th graders. I wonder how they're doing as they're transitioning into young adulthood. So that was about the time I was coming to Wheaton. And so my first research project here was the Adolescents Moving On project.
And so this is what you folks call a longitudinal study, right? So
you're
tracking these people
That's right.
Still ongoing with the same group?
That's right. Yeah.
Okay.
So we did all kinds of research to try and track down their current contact information because it had been 5 or 6 years, and able to contact about 80% of them, and had about maybe 100 students continue with us. So we collected data on 100 young adults, and we're still analyzing the data, but one thing that I did was I added some questions about alcohol use and reasons for drinking, because I'm really starting to integrate my interests in substance use as a coping mechanism with my research interests in depression. And so,
is that a growing problem among that age group? Is it worse than it would have been a number of years ago?
Is it a growing problem? I think it's been a significant problem for a long time. And young adulthood is that time when alcohol use can really spike. It's considered developmentally normative, especially for those who go on to college. Increase in binge drinking and significant problems related to drinking. And so there's a lot of research trying to understand what are those predictors to these huge increases in alcohol use and other drug use.
Let's talk a few minutes, Sandy, about your work with families, family dynamics, counseling families. And maybe a place to start is, if we alluded to this a minute ago, but do you find, is there a resistance among families to come for counseling, and particularly Christian families? Is there a stigma that's there, that there's a barrier to even coming in to see you?
Absolutely. I think there is a stigma, and whether Christian or not, I think it's lessening, but there still is that stigma. And it's unfortunate, because I really think that the sooner that families can come in, the easier our work can be. I remember when I was in private practice many years ago, within 1 week, I had 3 different families bringing in 14-year-old girls. And, for different problems. But I remember thinking, man, I wish they would have come 4 or 5 years ago. And, I understand families want to try and figure things out and work things out on their own. But sometimes families and just individuals wait until a crisis hits, and it's so much easier.
What are the signs? So if you go back to, say, that girl who would have been 10, if she had come when you wish she had, what would you say to a family, if you see these signs, those are sort of red flags, as opposed to just normal, this is the way a family is kind of thing. What would call me in for counseling?
Right. Well, depending on what type of distress they're experiencing, of course, there'd be different red flags. And I think that this is an important area of research. When are some of these distressing behaviors part of normal development? When will they grow out of it? And when is it really signaling the beginning of significant problems? So this is an area of significant research right now. I think that I just really encourage families to think about working preventatively, and to be, it's better to be safe than sorry, and to think about working with a family therapist as they would their family doctor. So you go in for annual checkups.
We're not used to thinking that way, are we?
No.
In mental health.
That's right. Yeah. But that's, I said, I'm your family therapist, and think of me the way you would your family doctor. I'd love for you to come in for annual checkups. Just check in with me. Initially they're in my office because there's a problem, and so I get to know them. Right. But then after that, we're just doing a checkup and just kind of consulting and just taking a look at symptoms as they develop.
Like? What would a routine mental health checkup look like?
That's a good question. Yeah. So I think I would probably ask questions about how they're doing in their relationships, and how they're managing conflict. Conflict is normal, and it's a normal part of life. It's how you deal with conflict. And what are the conflicts that keep coming back? And are they feeling like they need any help with that? Sometimes families just get stuck. If at first we don't succeed with a solution, we usually try again with the same solution. And oftentimes we just need to get creative and think outside of the box and think about other ways of doing things differently.
That can be, I think, part of the reason that people are reticent to come is that feels threatening. Even sitting here listening to you say that, if you asked us as a family the question, so how are your relationships? Immediately you think about all the bad things, right? This, and it feels threatening. And I'm wondering how you, as counselors, help us get over that threat, because that's probably why people have a hard time coming, isn't it?
Right.
They feel they're going to get beat up on or asked very, very difficult questions.
That's right. That's right. Well, I would say that that's part of our job, is to help clients come into our office and to feel comfortable and to understand what the process will be like. I try to help my clients to understand that you are the experts on your own lives, and I'm just here to walk alongside you. So I want to understand what life is like for you, and what are those areas that you want to be different. How do you want things to change? And
so it's not this sort of top-down,
that's right,
autocratic kind of counseling.
I'm not, I don't know what's best for you. I want to understand what you would like, and then we can figure out what's best for you.
Yeah. How does your Christian faith, Sandy, enter in? And I'm thinking especially if you're counseling someone who is not a believer. So if there's clearly no Christian faith,
right?
How do you integrate your faith in talking with that person?
Yeah, that's a great question. So as a therapist, and I consider myself a therapist who's a Christian. I don't call myself a Christian therapist because that is associated with a certain brand of therapy, right? So I'm a therapist who happens to be a Christian. So if I have a client who's not a Christian, to me, I'm just going to do therapy the way I would always do it. But what I've done previous to entering that therapy office is I've thought about the treatment approaches, and I've thought about how are these approaches consistent with my faith and consistent with what I know to be true from the Bible about how God made us and how he works in our lives. So then I go into the therapy office with confidence that the tools that I'm using and what I'm helping to equip my clients with are things that are consistent with my faith. And yet, I think it's so important to work within my client's faith and value system.
So you may not overtly say those things to that person, but you have that undergirding of just like any worker would. You can take Christ with you wherever your job is.
That's right, yeah.
What do you like about teaching here?
Oh, teaching. I love the students. They are the best. They are just a really special bunch. They're bright, they're inquisitive, they are just so compassionate and caring. They love the Lord. They want to serve him. And they are just so thirsty. And so it's really easy to teach. It's really easy to teach here. So I'm just challenged to really do my best to think about what they need to be best equipped to do what God has called them.
Yeah. Sandy, it's great to get to know you. Great to have you here.
Thank you.
Both at Wheaton and here on this program. Thank you for spending some time with us.
Thanks. It's great to be here.
Sandra Yu Rueger is Assistant Professor of Psychology at Wheaton. And by the way, if you're interested in the department and perhaps studying yourself, or if you have a student who's interested, please visit wheaton.edu and get to know the program just a little bit better. For Inside Wheaton, I'm Greg Wheatley.